to take care of our children and grandchildren. We are having children later in life. So we are doing more than we ever have actively at this point in our lives. And as you mentioned earlier, when the ovaries start producing less estrogen and are kind of calming down or slowing down, the adrenals are what have to take over for that whole process that the ovaries used to do. So if we have impaired adrenal function to begin with, it can't really take that increased burden.
Welcome to another episode of Michigan Family Wellness.
Here at Michigan Family Wellness, we believe chiropractic care and nutritional-based therapies are a foundational part of a healthy family lifestyle. No matter where you're at in the mitten, having a family is such an exciting time of life. So instead of feeling overwhelmed by stress, fatigue, and responsibilities with the kids, we invite you to become part of this empowering community to create happy, healthy families. By providing engaging interviews and practical applications, Dr. Wollner cultivates family health by equipping our listeners with the tools they need to elevate wellness in their own family. Dr. Wollner passionately serves the Michigan community at his chiropractic and nutrition-based practice, where he specializes in pregnancy, pediatrics, and family wellness care. And now, here's your host, Dr. Kyle Wollner.
Good day, everyone, and welcome to another empowering episode of Michigan Family Wellness. I'm your host, Dr. Kyle, and I just want to highlight a few things before we get to today's really exciting and empowering interview. So, it's official. We are now in a series of women's health with our live events over at Canton Summit on the Park. We had a great time at Chiropractic Care for Pregnancy and Pediatrics. But the real purpose for today's podcast is to highlight a live event that we have coming up. It's called the Female Hormone Symphony, and it's on August 6th. And I wanted to bring Susan's unique perspective, her superior perception, so that you guys can get some real value and benefits from today's episode. So, without further ado, let's introduce Susan. Susan Pontak is a registered nurse with experience in family practice, corporate wellness, along with integrative hospital settings. She is also a wellness and life coach. Susan has over 20 years' experience in the healthcare industry, and for the past 13 years, she's served doctors in the field, like myself, as a functional medicine consultant for Metagenics. On top of all that, she's a Michigan native and a loving mother. So without any further delay, let's jump into the interview. Welcome to the podcast, Susan. It's so great to have you.
Hello, good morning. Thank you for having me. I am really happy to be here.
You know, I can remember meeting you for the first time and just being so impressed with your professionalism, with your knowledge about, your passion, like what you do, your unique perspective. This is not necessarily a first in the sense of having a liaison, someone that works between the formulators and the manufacturers for a lot of the nutritional medicine that I use in the office. But it is the first time that we've actually had Susan on the podcast here, and someone that actually can talk about specifically all the options and tools to equip our patients specifically from Metagenics. So, Susan, I just told our listeners a little bit about you as the professional, but what can we learn more about Susan as the person?
Well, thank you. I really appreciate that, Dr. Kyle. And I can say that after more than 20 years in this business, in the profession, I always say that this is still what wakes me up in the morning. I love this profession. I love what we get to do. I think it's such a privilege to be able to affect lives by just giving people the information they need to make those changes. So thanks again for having me. So personally, I am a mom of two grown children, and I have a daughter who's married and is expecting my second granddaughter any day now.
Congratulations.
Thank you. It's really exciting. It's just like a club that you get to belong to that brings greater joy than anything I've ever experienced. And then I have a son who's a professional chef, and he lives out in Colorado. I have lived in Michigan my entire life, and there's no place I'd rather be.
Fantastic. Yeah, great segue. My next question for you was, one thing we love to say here on the Michigan Family Wellness Podcast is that we're smitten with the mitten. So I always ask my guests what they love about Michigan.
I think First and foremost, I love the changing of the seasons. I love every single thing that we get to experience here, from the beauty of the fall colors. And I'm very much a water person. I have a couple of beaches in my neighborhood that are walkable, and I've lived on the water most of my life. And I find nothing more spiritual and calming than to sit by the water and just listen to what it has to say.
Fantastic. Yeah, I can relate to you there as well. Just growing up, someone that started in swimming and just kind of was a swimmer from, day one. That was my first sport. I really have this love for just, being out on Lake Erie and just really enjoying the water. Any water really is always a good thing to be around.
It is. It's really calming, and it's just such a beautiful place in Michigan, whether it's winter or summer, to walk out on the ice and listen to the sounds. And I particularly enjoy that we have the seasons, because I feel like when it's sunny all the time, you don't get that time to kind of go within and be reflective. And I think winters in Michigan allow you to do that.
Absolutely. Well, thanks so much, Susan. Let's go ahead and dive into some of the content that we're actually here to talk about today. So, one of the reasons I wanted to bring you on the podcast as a unique guest, a expert perspective, was we have this live event coming up at Canton Summit on the Park all about the female hormone symphony. And I wanted to bring your unique perspective and your expertise in this area so that you can talk about the value and the benefits for our listenership in terms of natural alternatives to female hormone imbalances and female hormone dysfunction. So I'm about to quote to you some numbers from 2014, so arguably these numbers are already outdated. But here's the thing, Susan, over 50 million women have already reached menopause. And so what I see in my office, what I see with my patients, are that many of my patients, many of our listeners are having the following issues. They're having sleep disturbances. They're having irritability, just not, but that isn't related to anything specifically. They're having depressive moods or just a decrease in their overall mood. They're having anxiety. They're having physical, mental, and emotional exhaustion. One thing people tell me are joint and muscle complaints, urinary tract symptoms, and even vaginal dryness. So as a liaison for Metagenics, you're the person that works, with the doctors in the field and also with the formulators on the other side of the equation, and drawing on over your 20 years of experience as a healthcare professional. How does Metagenics contribute to the natural alternatives for women that might find themselves with these kinds of experiences?
Yes, welcome to the baby boomer generation with all of the women who are reaching menopause. And it's called the change because we often say that everything changes at this point. So we have several things that we can offer women to help balance, and it certainly is a symphony. One of the products that we have exclusive to Metagenics is called Estrovera. And Estrovera is one ingredient, Siberian rhubarb root. And it's just like it sounds. It's the vegetable plant rhubarb. And that's all that's in it. And that single ingredient has been used in Germany since 1993 and became available in the United States in 2009. So not very long. Again, I say it's exclusive to Metagenics because maybe a lot of people haven't heard about it. It actually will reduce collectively the menopausal symptoms by 83%. And most especially, it is in the studies shown to be as effective at hormone replacement therapy for relieving hot flashes. In the studies, and we have many of them, it reduced the number of hot flashes in 4 weeks, but continues to become more effective. And the average reduction in the hot flash frequency went from 12 a day down to 2 a day. It doesn't only work on hot flashes, though. It works on all of the menopausal symptoms. So many of the things that you mentioned, from depression and anxiety, sleep disturbances, irritability, muscle and joint pain, urinary tract symptoms for sure, and vaginal dryness. Although Metagenics has many other products that work concurrently with this product, we'd like to do a full assessment on the woman, and Metagenics will often have the doctor have the patient take what's called a stress identity questionnaire so that we can see how the adrenals may be playing a part in all of the menopausal symptoms. So it's very much a well-rounded approach, with Estrovera kind of being in the center for those symptoms that we discussed.
Susan, there's another thing I wanted to mention in regards to, just really being specific with not only chiropractic adjustments, but with the tools that we're using in terms of nutritional medicine. And the approach that I take in my office is I'm never just going to blindly recommend a supplement or an herb or a vitamin or, a specific method of delivery. I'm always going to test the patient so that it's specific for their neurology and their body, okay? And I do that with applied kinesiology or muscle testing. Many of my patients who are listening already know this. So my question for you is here, why specifically rhubarb? There's been lots of other herbs, that have been shown to possibly help with these estrogen imbalances, but go ahead and speak to why specifically rhubarb.
Well, Estrovera and rhubarb has actually been the first supplement available and on the market that transcends the placebo effect in clinical studies. So that means they actually showed an efficacious effect with this product. Most of the other supplements that have been available to date to treat or to help with menopausal symptoms, like black cohosh and red clover and soy and hops, those are a few of the things that have shown minimal results and not much better than placebo in many cases. And in some cases, it actually increases the menopausal symptoms. So Estrovera has really been the first in its class to show any efficacy.
Fantastic. Yeah. So just to be clear for our listenership, would you say, Susan, that we're really talking about women who are in that perimenopausal, that menopausal, and that postmenopausal stage of their life?
Exactly.
Okay.
It usually starts around 45 to 55 with the perimenopausal, and then somewhere in that area of 50 to 60, most women are experiencing menopause. And that transition is very individual depending on the woman's genetics and the health of the rest of her body, how she's going to go through that transition.
Yes, and that's a great point. One thing I see a lot of in my office, and, of course we're talking generalities here. I mean, no two women are the same, no two pregnancies are the same. And, every woman is going to go through a little bit different experience when it comes to this stage of life that we're talking about. However, we do want to highlight that what happens in this stage of life is that the ovaries actually start to decrease their production of estrogen. And so when that happens, we start to get all of the symptoms that we've mentioned. And so this is why I wanted to have Susan on, because, as a chiropractor, I'm really into natural alternatives, non-hormonal therapies. And I just think I've had really great success with a couple of my patients. Again, everyone's different. So that's why you should work with a qualified healthcare professional to figure out what's best for you. But when we use this Siberian rhubarb on specific people in specific dosings at a specific level for a specific time, we get really good results. And it's really due to the phytoestrogenic effect. So I wanted to ask you about that, Susan. Can you tell us I don't want to get too technical for our listeners here, but can you explain, it's not hormone replacement therapy. It's the rhubarb. It's the specific form of rhubarb that's affecting the estrogen receptors. Is that right?
That's correct. And to be very clear, there is no estrogen in this product at all.
Mm-hmm.
And so that makes it very safe for most women to use. The only contraindication or person that may not be able to use this product, of course, we would never use it in pregnancy or nursing. We have no studies, and that's not the particular person that it's kind of targeted for to begin with. But women that have had any kind of estrogen dependent cancer should not use this product. And not because we think it is unsafe, but because we don't have the testing.
Mm-hmm.
So that being said, again, no estrogen intact, no estrogen response. So because it is a plant extract, it binds with certain estrogen receptor sites in the body. But where this particular product tends to affect these cell receptor sites is what is called the estrogen beta, which is opposite of what the hormone replacement therapy affects.
Mm-hmm.
So hormone replacement therapy works in what are called the estrogen alpha receptor sites. And that's where you can have some of the cellular changes that can affect certain oncology conditions. So this being that working on the estrogen beta receptor sites, that's where we get the calmness in the mood and the other symptoms that are with menopause.
Absolutely. I really love that specificity. You mentioned those estrogen receptors, in the same way that I am just so specific with my chiropractic adjustments. It's not just this generalized mobilization. It really is a targeted, dialed in, focused chiropractic adjustment that profoundly impacts the central nervous system. I really love the way this Metagenics Estrovera, this form of rhubarb, specifically targets that beta estrogen receptor that you were talking about. And again, as someone that's really into neurology and brain health, there are estrogen receptors all over the body. And so when you talk about the causal chain factors, or just, the other things that can be affected by a deficiency in estrogen, you can really see different effects in terms of bone density, brain health. A lot of the receptors in our brain actually have estrogen receptors, and when those just aren't firing well, that can cause a lot of neurocognitive, neuroemotional issues. And so again, I really do appreciate the specificity of this form of rhubarb to really target that estrogen beta receptor. Now, another question here for you, Susan. What if a woman is already taking estrogen hormone replacement therapy? Is that going to be an issue with Estrovera, or go ahead and talk about that?
So that's a great point. This product can be used in the perimenopausal period before a woman feels like she needs to look at hormone replacement therapy, or to avoid hormone replacement therapy. Sometimes we can avoid any kind of other intervention by using Estrovera and making sure the diet is right, the gut health is very good, and also the adrenals being balanced. But sometimes a woman decides to make that choice with her doctor to use some of the bioidentical hormone replacement therapy, and this product can actually be used concurrently or taken as well. And many of the physicians like to use this so that they can keep the hormone replacement therapy at a low dose and use Estrovera for any breakthrough symptoms. I've also seen doctors use it to wean women off of hormone replacement therapy so that they don't suffer the rebound effects of coming off of it. And then you can use the Estrovera for as long as needed, with or without. So yes, good question.
That's a major point there too. And I tell people this all the time. It's not that I'm anti-drug or that I'm anti-surgery. We need those avenues. We need that medical framework to keep us alive, for emergency situations and just for those exceptions to the rule. But I would say for most people, the long-term dependency on a pharmaceutical, and again, this is specific to, everyone's different. You're going to have exceptions here and there. But when you start, gosh, even some of the patients that I've worked on recently, 16, 20, their mid-20s, and they're starting these hormone medications, and they plan on being on them for the rest of their lives. And so to your point there, Susan, to be able to use a natural alternative to assist or even to complement the effects of a medication, I think that's wonderful. And I would also highly recommend, just in terms of baby stepping off of a medication, using a mechanism like this, having this kind of alternative is just a great way to go. So I want to ask you more about how can women actually get their hands on this specific form of rhubarb? Can you find this on Amazon? Can you walk into a Walmart and buy this off the shelf?
Well, Metagenics is what we refer to as a professional line only. And in order to buy Metagenics, you have to get it through a licensed healthcare provider. And we believe that's very important because those are decisions that should be made between you and your healthcare provider. This is not something, and Metagenics is not a line that you can just walk into a health food store. There are physicians that do choose to sell it on Amazon, but you need to be a patient of theirs and have a provider code in order to get these products.
That's great. Like I said, in my office, quality rules the day. If I'm not working with the highest quality physical nutritional medicine, that's what my patients deserve. They deserve the absolute best. So I wanted to kind of circle back. You've mentioned a little bit about the adrenals, at several points in our podcast here. And I just want to really touch on for our listeners, the importance of really making sure the adrenals are taken care of and supported. And so let me ask you this, Susan. In your clinical experience of over 20 years, do you see a lot of straight up just adrenal fatigue, or do you like to look at what's known as the HPA axis, or what I like to call the hypothalamus pituitary adrenal axis? Because one of the things I'm seeing in my office is, there's been a lot of people that have just had flat out adrenal fatigue, but I'm getting a lot of good results lately just by helping people's brains. So I wanted to ask you about that.
Good question. And if I may, I'd like to go back just a little on the professional line question that you asked. And one thing that I always like to point out, because no matter how long I do this, I am always amazed how people and the general public do not understand that the supplement industry is unregulated. And so they don't understand that when you are buying an over-the-counter supplement, there is literally no governing board that is overseeing what is in that supplement. The FDA does have people who are looking at nutritional supplements, but by and large, there's no standardized industry for it. And so one of the recent articles published in JAMA actually talked about 55 different bottles of vitamin D that were pulled from 12 different manufacturers. And of those 55 bottles, the label content of that vitamin D, in other words, how much of that vitamin D was in that bottle actually contained in those capsules or tablets, ranged from 9% to 146% of what was label claim. I always like to use the example of vitamin D because it's so important in the body, and especially with women's health and most specifically prenatal health. There is a higher increased risk of miscarriage when vitamin D levels are inadequate or under in the body. And if you're sending your patients and they are obtaining a bottle of vitamin D that is literally 9% of what's on that label claim, it just really makes me sad when people don't understand how important it is to know what you're buying, know that it's clean, and know that that efficacy is in that bottle to what's on that label.
You bring up such a good point there, Susan, and I'm really glad that you actually, circled back and addressed that, because honestly, it's a major deal, to be able to tell someone that, hey, this rhodiola that we're going to give you to help your, hypothalamus pituitary adrenal axis, like this is the highest quality rhodiola in the world. You can't find this on Amazon or walk into a GNC or a Walmart, just using rhodiola as an example, or even rhubarb for that matter. So I'm really glad you make that point. And even back to what you were saying about vitamin D, it really is the neurohormone, so much more than just a vitamin, so much more than just a it really is this neurohormone, and I think it really ties into our discussion on estrogen here in terms of the osteoporosis effects. You do need great calcium, you do need vitamin D, and you do need healthy levels of estrogen to have good bone density, especially in this stage of life that we're talking about. Would you agree?
I would completely agree. And I just really like to bring that up because I feel like the general public is just not aware that what they may be buying isn't tested. And not only does it sometimes come in under potency or over potency, but we need to make sure that what we're taking is not contaminated with heavy metals and with molds and yeasts and all kinds of things that can be part of a nutritional supplement, especially in some of the herbal formulas that can come from China or India, and those aren't always the most scrupulous manufacturers. So I think that it's really important. Of course, in medicine, it's first do no harm, that you need to be aware of what you're giving, prescribing, and as a consumer, what you're taking. So
absolutely. And just to round out my thought in terms of other clinical applications in this whole brain, adrenal, menopause thing that we're talking about here, one thing I'm noticing in my office, in my practice, is, I'll do the adjustments, I'll support the adrenals with nutrition, specifically either like a glandular or maybe a whole food or a vitamin approach. And for some people, for some cases, that just really isn't helping them hold their adjustments or calm down or get any kind of relief of symptoms. And one of my interests is, people are always telling me that they can't sleep or they're constantly waking up at night. And I'm finding that when you address the brain, so when you talk about the hypothalamus and the pituitary, those are actually hormonal glands that are inside our brain. And when you support specifically those frameworks, those functions in the endocrine system, not only with chiropractic adjustments, but with also nutritional medicine, what I'm finding at least is that I get significant results rather than just supporting the adrenals alone. And I was just wondering if you'd seen anything like that, Susan.
no question. I think that part of what is going on is that we just really haven't adapted. Our bodies and our genes have not caught up with what has happened in, let's just look at the last 100 years.
Mm-hmm.
Let's look at what our grandparents were like and what their lives were like. And I think as women in this menopausal stage of life, traditionally, that was a time that we were slowing down. We had raised our families. We were, the life expectancy certainly wasn't what it is today. And when we are in this stage of life, it's so different because we're still working, and sometimes we're at our highest point in our professional career. Many times we are also taking care of elderly parents, or we could be possibly taking and helping to take care of our children and grandchildren. We are having children later in life. So we are doing more than we ever have actively at this point in our lives. And as you mentioned earlier, when the ovaries start producing less estrogen and are kind of calming down or slowing down, the adrenals are what have to take over for that whole process that the ovaries used to do. So if we have impaired adrenal function to begin with, it can't really take that increased burden. So those adrenals have to be optimized at all costs. When the adrenals are impaired, one of the first places that it shows up is in increased agitation and decreased ability to stay asleep. So many women can fall asleep, but what happens is they wake up usually between 3 and 5 a.m. And it takes about an hour and a half to complete the cycle of where the adrenals are kind of off at that point, and they will tell you, I can fall asleep just about the time that the alarm is ready to go off. Mm-hmm. And they repeat this cycle over and over. And that's because the circadian rhythm or the normal body clock is kind of off. And that's where we have to look at resetting that. And so it kind of works off of symptoms and how are you sleeping? How do you wake up in the morning? How do you feel? Are you refreshed, or do you have what we call refreshed sleep. So there are a variety of supplements along with chiropractic adjustments, along with the whole body approach, spiritually calming, whatever it is that you need to do, that we look at for resetting that circadian rhythm so that we can restore normal sleep patterns. And I think that is a big part of helping to control the symptoms of menopause and most specifically hot flashes.
Absolutely, Susan. You know, I can hear the conviction, the passion in your voice. I know our listenership can too. You're giving me a little bit of a chill over here. It's just so exciting to, be able to bring this empowering information to our listenership and to the people that we love and serve and care so much about. A central tenet here on the podcast, Susan, are those practical applications. So one of the things I might ask my patients to do, specifically when we're trying to, get that 30,000-foot view of any kind of, female hormone symphony or any kind of hormonal imbalance, is actually keeping a weekly hot flash diary. Just to help them track things, track their symptoms, maybe before they start treatment and then maybe after they start using the rhubarb that we're talking about with Estravera. Are there any other practical resources or things that you could equip our listeners with in terms of practical applications to help them, elevate their personal wellness or their family wellness in this regard?
I think a hot flash symptom survey is really a great idea, because what we often see as well is when the hot flashes improve or the symptoms all improve, they forget how bad they were feeling until they look back at that frequency. So that is something I always recommend as well. I think that you should track your sleep. And in my patients, when I first are working with someone, I like to see a food journal. Mm-hmm. And not because I have a red pencil that I'm like, oh, you shouldn't be. That's not the case. I really like to see where the snapshot is, because I believe that things should always start with food. And if there are changes that we can make to put the patient on a healthier trajectory, I think that's such a good place to start.
Fantastic, Susan. I just love bringing like-minded people and passionate people here on the podcast. I want to thank you again for joining me today on this episode of Michigan Family Wellness. And if you're listening to this podcast and this message is resonating with you, or you feel like you've experienced some of these hormonal imbalances or symptoms that we've talked about, I would highly encourage you to head on over to MichiganFamilyWellness.com. And you can actually schedule a complimentary 20-minute phone call consultation where you would be able to talk with myself, and we can begin this dialogue. We can even start some of those symptom surveys or some of those food logs that we've talked about, and really develop a dialogue on how to best approach elevating your health and wellness. And I also want to remind everyone that we're going to have a dedicated webpage to Susan's podcast here with all of the show notes, resources that we've mentioned here, clickable links, all at MichiganFamilyWellness.com. You can also, if you're listening on your mobile device, like over 60% of our listenership is, you can expand those show notes right on your phone, and you can take advantage of those clickable links right there, right now. Susan, thank you so much for coming on the podcast today. Do you have any final words of wisdom or words of affirmation that you'd like to leave our listeners with?
I just want to say thank you for allowing me to be a part of this, and that I would love to be a resource for you whenever possible. Women's health, as well as neurological health, as you mentioned, is one of your passions, is also one of mine. And so thank you so much for the opportunity.
And thank you, Susan. Actually, as we were talking, I was actually thinking in the back of my mind, we should probably have you back on, maybe just to talk about adrenals or even some of the sleep things that we were talking about. So thank you very much for coming on the podcast again.
Thank you.
And remember, we can do far more together than we could ever do apart. Coming to you from beautiful Southeast Michigan, I'm your host, Dr. Kyle, and this is Michigan Family Wellness.
Now that you've been equipped with the latest in family wellness solutions, we want to encourage you to apply these strategies right away. But the thing is, there's still so much to learn. Connect with Dr. Wallner's Chiropractic and Nutrition Office by going to MichiganFamilyWellness.com and click the newsletter sign-up button to join the informative and supportive community of chiropractic wellness. You will also receive as a gift from Dr. Wallner a copy of Michigan Family Wellness Solutions, an invaluable resource containing dynamic tools to elevate family health and vitality. Michigan Family Wellness wants to thank you for being part of today's podcast. Please subscribe to our podcast on iTunes and give us a 5-star rating and review.